Good afternoon and thank you for joining us. My name is Tina T-Bone. I will be your moderator for this afternoon's news conference. Joining us today, the Honourable Stephen McNeil, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Tina, and good afternoon, everyone. Today we're announcing 37 new cases of COVID for a total of 87 active cases. But 37 cases in one day, if that isn't enough of a concern, I don't know what is. If you haven't woken up to the second wave, this is your wake-up call. The majority of today's cases are in the greater Halifax area, between the ages of 18 and 35. We have one in the northern zone that is connected to Halifax, and one in the western zone, a student at Northeast Kings Centre in Canning. The student is not in school today and has been self-isolating. We are closing that school for the rest of the week to conduct a deep cleaning and really to give public health the time to do contact tracing in the community. There is no doubt that COVID is in our communities and it is trying to take a grip on the greater Halifax area. We need to stop the spread now. So it's time to take some tough measures. Dr. Strang will go through them in detail, but I want to highlight a number of things that we're going to do to seal up the greater Halifax area to prevent COVID from seeping out. Effective midnight Wednesday, for the next 2 weeks, all restaurants, licensed establishments will be closed to in-person dining, but takeout and delivery can continue. Profit and not-for-profit fitness, recreational facilities, all gyms, yoga studios will be closed. Libraries and museums, including the Nova Scotia Art Gallery, will be closed. Casino Halifax and First Nation gaming establishments also closed. The new public gathering limit is now 5, and don't forget, we've already announced no more than 5 visitors in your home. That doesn't mean you can have a house party, but if you decide to and take a collection to pay the $1,000 fine breaking the rules, well, we've changed the rules. Going forward, there will be stronger enforcement for illegal gatherings, including a $1,000 fine for every person who walks through the door. Dr. Strang will have more details on the rest of the new measures. But before I turn it over to him, I want to thank our businesses and associations for their input and their support. I want to thank the Mayor of Halifax and his team, including Halifax Regional Police, for supporting us, our teachers and parents for working with us, and of course, Dr. Strang and his team, including our ministers and deputies who are working tirelessly to try to keep Nova Scotians safe. Dr. Strang.
Premier, thank you. Good afternoon. Before I start, I want to just quickly say I talk a lot of times about being caring and compassionate. Last briefing, I was brusque with Mr. Bousquet, and I apologize for that. I could have used a different tone. So here we are now. Since our last briefing on Friday, we've announced 67 new cases of COVID-19, and that includes 37 cases reported today. 35 of those in Central Zone, and one is in just on the other edge of the border in which is now Northern Health Zone, but related to exposures in Central Zone. And today we also confirmed a case of COVID-19 in Northeast Kings Education Center in Canning, Kings County. That case is under active investigation to get more details, and that will be more to come on that hopefully tomorrow. But we do know that that person has not in school today. They are self-isolating. As a precaution, the school will be closed to students and staff starting tomorrow until Monday. But we will monitor and reassess that as over the next few days. Public Health is in touch with all the close contacts as our investigation unfolds, and any close contacts are always immediately isolated. So if we look back, we really know that our first wave we're looking back now, clearly started in October. In September, we had 3 cases. In October, we had 21. And so far in November, we have had 118. 85% of those, or 72%, of those reported in of the 118, so 72% of our cases in November are in the 18 to 35 age demographic. So clearly we are on the second wave. It is focused here in HRM. It is focused in that 18 to 35 demographic. That is just the nature of this virus, that when you get in an age demographic where social activity is an important part of the way they live. Everything I'm going to talk about now, our focus needs to be on how do we stop the virus from spreading further. Beyond HRM, how do we stop the virus from robustly spreading into other age groups, even within HRM? And creating, spreading to people who are at much higher risk of severe disease. That needs to be our collective goal. I know how difficult it is. It's certainly been difficult for me yesterday and talking to my team and seeing throughout the day the number of cases that were coming in. I need to put it in perspective and context. Everything we're announcing today will have an impact, but because of the incubation period of the virus, we were going to see these high numbers continue for the next week to 10 days. Everything we're seeing today, the cases we're reporting yesterday and today, are a result of things happening a week to 2 weeks ago. So as we start to see the impact of our tough measures, it will take at least a week to 2 weeks, if not 10 days, to really start to see the impact. I just want to make sure people understand the context and they're not surprised when we still see high cases in the weekend. We know that's going to happen, but that's why we're tightening down now and to get on top of this as quickly as possible. We are going to see more cases. We might well see some isolated cases outside of HRM, and we will act on those very quickly. We also have to be prepared that we may see cases in our local hospitals and long-term care facilities, but we are prepared there as well. And I'm telling that I don't want to scare people, but I want people to have a realistic picture of what we're facing. It's a stark reminder to us about how we all need to, if we've forgotten how serious COVID-19 is, this is a reminder. And we all need to work together to get ourselves out of this, and we all need to start today, now. So last week I announced restrictions that impact the most densely populated parts of HRM and then bordering communities in Hants County. I'll describe those in a minute, but we are now expanding because of the close connection and the flow of shopping, etc. We're now expanding that geographic area beyond Enfield to also include Elmsdale. So the area that we're talking about, and the area where when I say the HRM areas that are focused in, it starts at Hubbard's all the way into the downtown peninsula. It goes from Bedford to Sackville to Mount Uniacke, and then out through Fall River past the airport to Enfield and Elmsdale, and then it includes Dartmouth and east of Dartmouth all the way to Porter's Lake. That is the geographic area that we're talking about that the majority of these restrictions will apply to. So last week, in that area, we announced that the gathering limit was to 5 for social gatherings, and that people could have no more than 5 into their home. That is remaining in place, but we're going much further than that. And as I said, the reason we're doing this is absolutely critical. That we need to do this and do it now to minimize any further spread within HRM and minimize the potential to spread in other parts of the province. If we don't do that, all we need to do is look elsewhere in the country. We are instituting these tough measures. And this is not to be critical of any other province. We have the advantage of being one of the last ones. But if we look at where it's happened in the rest of the province, they've instituted these tough measures far later on in the course of the virus, in the second wave. And we do not want to be in the position that they're in where their health systems are overwhelmed, where public health is overwhelmed. We're doing it early to get out in front of this and minimize the chance of us being in that very difficult position. So effective starting at 12:01 on November 26th, and it's at least for the next 2 weeks, and we'll monitor it as it the need to go beyond that as necessary. Bars and restaurants in the geographic area will close for in-person dining. Takeout delivery is allowed, and we have made an exception for hotel restaurants only for their guests, nobody else. Breweries, wineries, and distilleries must close for their tasting areas, but they can stay open for retail sales. Fitness, recreational facilities, including pools, rinks, private, gyms, yoga studios, the whole range of those are all closed. Libraries and museums, including the art gallery, are closed. The Halifax Casino, along with, we have 3 First Nations gaming establishments, 1 in Cole Harbour, 2 in the Hammonds Plains area. Those will all be closed. We are stopping any organized sports, recreation, and athletic activities, and that includes teams traveling into and out of the Halifax area. So if you're a hockey team based in Halifax, you cannot, there's no practices, no games. If you were planning to go to the tournament in Cape Breton this weekend, I'm sorry, but you're staying home. If you're an elite hockey player, I'll use this as an example, who may be on a regional team based that the team is in outside of Metro, maybe up in the valley, you cannot travel to that team. If there are teams from outside of HRM that were planning to come to HRM for a game or a tournament, you can no longer do that for at least the next 2 weeks. You can still play. We're not shutting down sports outside of HRM, but what we're saying is we're going to limit any travel to local travel. So if you're a hockey team in Bridgewater, you can go and play in Liverpool, you can go and play in Yarmouth, but you certainly can't go to Truro, you certainly can't go to a tournament up in Cape Breton. Any sport-related travel has to be close to home. And certainly there can be no travel for any kind of athletic, any sports, or for any other reason, a non-essential reason, into HRM. I'm taking some time on that because we've already gotten lots of questions. It's important that people understand that. We're closing arts in the Halifax area, arts, culture, special events, faith-based gatherings. They can continue, but only up to a maximum of 5 people. So in reality, that means virtually all of them are closed down. And we're also taking action to reduce the number of people in confined indoor retail spaces. So again, effective Thursday, 12:01 a.m., shopping malls and retail stores in the Halifax area will also have to limit their number of customers to 25% of their legal capacity. So this is based on any retail environment will know what their maximum capacity is based on the building code, number of people per square footage. So let's say there's a store that their legal capacity is 100, starting Thursday, 25. But it's also a reminder, we're doing this because we know that the crowded shopping spaces are one of the areas that are of significant concern. So we're putting this limitation on retail businesses, but it's also an important reminder for people who live in Halifax and for all Nova Scotians. Certainly in Halifax, that you should be focusing on essential shopping only. If you do need to be holiday season is coming, there are online options that you can have delivered, or you can go store pickup. And I would certainly encourage people to take advantage of the many wonderful local Nova Scotian artists, artisans, craftspeople, etc., that you can do online shopping with. To go into a store, you should really be only going into a store for essential shopping only. And if you do go into a store, it's critical that you wear a mask, follow the directional signs, wash your hands. We need to decrease the crowds in stores. If you were thinking you're coming to Halifax this weekend for Black Friday, please think again. we're saying non-essential travel only in and out of HRM. HRM, for the next 2 weeks at least, is not a shopping destination for the rest of the province. We're also making masks mandatory in common areas of apartments and condominium buildings in the Halifax area. So we're expanding the requirement for masks in indoor public places, actually into the common spaces of these multi-unit dwellings. As we continue to control the spread of the virus, we need to have a particular focus on those who are most vulnerable among us. So effective 12:01 Thursday a.m., 12:01 a.m. on Thursday, across the province, not just in Metro, all long-term care facilities will be closed to visitors, except for volunteers and designated caregivers who will be allowed inside. It's important that everything I've laid out, these measures are, as I said, twofold. We need to take these actions now to protect more vulnerable people by age within the Halifax area. We do not want this virus spreading into especially older age groups. We have to minimize the chance of it getting into our long-term care facilities. We also want to make sure that we're doing everything we can to prevent the virus from spreading from Halifax into other communities. And that's why it's critically important that people not travel out of Halifax. It's critically important that people don't travel into Halifax. And the only travel in and out of Halifax needs to be for essential purposes. If you need to come to work, if you need to come for medical treatment, etc. But other than that, you need to stay closer to home. That's on top of, there's been lots of discussion in the last couple of days, you've seen in the media about the Atlantic bubble, and PEI and Newfoundland have now put quarantine restrictions on people coming, even from Nova Scotians coming into the provinces. We're increasing our message that even along with being careful about how you travel within the province, we're reminding people that now is the time to stay within the province, that there should only be essential travel even to other Atlantic provinces now, out of Nova Scotia. So as I said, it's a reminder, if you live in Truro and you work downtown, you can travel for work. If you need coming from even Cape Breton for a medical appointment, you can come for that medical appointment. But it's critically important that we don't have people coming, and I keep coming back to it, the emphasis around Halifax, especially at this time of year, is a shopping destination. That we cannot have that, at least for the next 2 weeks. We are also, as a precaution, asking our school system to have any extracurricular activities that involves travel between one school to another is to be stopped for this period of time. What will remain open is our schools. We have worked very hard to create safe environment in our schools. School-age children are not where we're seeing the virus activity. We also have not seen any instances where a school itself has been where the virus there's been exposure. Even the couple of school cases we've had, they have been exposed somewhere else. So the schools remain a safe environment. As we talked about all through the reopening plan, keeping schools open as much as possible is critically important. Being at school is important for the mental, physical health and development and socialization of our young people. So we will always take the appropriate actions to keep our kids and students safe. But I emphasize that at this point in time, our schools remain safe, and we are not going to be closing schools other than in reaction to certain cases. If we have to change that, we will, and we'll do that quickly. After-school programs, or before and after-school programs, daycares remain open. Any workplaces that aren't covered by what we just announced are remaining open. Health services in our hospitals and community-based healthcare providers from a range of regulated and non-regulated health professionals remain open. Personal services establishments, including hairstylists, estheticians, and barbers, they remain open, except we are going back to exclude any procedures that involve the face and the client having to remove their mask. People may say, why are you keeping those open when we're closing other things? We have no evidence at all that those personal one-on-one interactions are creating exposure. It's because whether it's the healthcare providers or the personal services, they develop very robust COVID safety plans as we reopen them, and they continue to follow those safety plans. Everything we've said and all throughout this, my approach has been from the beginning of COVID that I believe that Nova Scotians, when they're asked to follow a set of rules, the vast majority will follow those rules. I have to ask everybody today that we're putting these in place to keep each other safe. Please do not look for loopholes. Please do not look to skirt around the rules. We need everybody to do the right thing for each other. But we know that that's not always going to happen. So as the Premier said, we are working with our police and other colleagues to enhance our enforcement. I had a conversation with chiefs of police today, and in the Halifax area especially, they're going to be stepping up their enforcement with a focus on private gatherings. We're also having very productive conversations with HRM, and I thank them for coming to the table in a very collaborative manner, that their Halifax Fire, their bylaw officers, how they could also play a role in supporting enforcement of COVID regulations. And we have our own government, alcohol and gaming, occupational health and safety, our Nova Scotia environment folks, that we're not going to be needing them inspecting bars and the restaurants for the next couple of weeks. So we're going to be making sure we're having a strong focus on supporting private gatherings, but also a strong focus on enforcement in the retail environment as well. And as the Premier had said, that we are going to be working a warning to everybody that if you're at a private gathering, it's not just the host that can be fined. Every single person there can be fined $1,000. So we are working with our police colleagues around that possibility. But it's important that the Nova Scotians understand that we take this seriously. We need them to take it seriously, and if they don't, there are substantive financial penalties to that. But I hope it doesn't come to that. I hope every Nova Scotian sees the need for them to simply do the right thing, take actions around how you limit your social activities, limit the number of people in your social circle. In the HRM area, follow all the strict rules we now have in place. And I'm also encouraging Nova Scotians, if they see activity in a community that appears that there's a group of people that aren't following the requirements for social gatherings. Again, in HRM, that's no more than 5. And outside of HRM, house parties is a maximum of 10. If you're seeing activity that doesn't appear to be following those, please call the non-emergency police line in your where you live. Police are very aware of that. They'll be getting these calls. They already are. We're talking with the Halifax Police yesterday. They had 55 calls yesterday that they responded to. So we need to look out for each other. But one of the ways we look out for each other is making sure that that police and enforcement is aware when there are an unfortunate few who aren't following the rules. Another key part of our strategy in the next 2 weeks is moving into asymptomatic testing. So while we'll continue our focus on testing people who have symptoms, and it's critically important to remind people that, and especially now because in the Halifax area we have more COVID activity. If you feel unwell in any way, stay home or go home, do the online assessment and get direction about further testing from there. But we're also now knowing that if we look at the vast majority of our positive cases in the last several weeks, they've been young adults, many who've been, lots of social life, going out to work, Many of them have actually, as we're testing contacts, but there's been a number who are actually asymptomatic, but there's also been many who have very, very mild symptoms. That's the nature of this virus. My colleague, Dr. Lisa Barrett, calls COVID-19 the stealth agent. Excuse me. And that's actually a really good description of the virus. It stays silent for up to 2 weeks while the infected person goes about their daily life, whether people are asymptomatic or very, very mildly symptomatic. And if people going about their daily lives and they're exposing lots of other people. And a single night out, somebody who's asymptomatic can result in dozens of exposures. And in those people, it can then take 2 weeks for them to develop symptoms if they ever get symptoms at all. And they themselves might be out socializing. That's why we're tightening things down, but it's also why today we announced that we are now opening up a stream of testing. If anybody has been, we're saying anybody who works in or has been in the last 2 weeks has been in a bar or a restaurant in the geographic area in HRM, if you go on to our online, through 811, our online self-assessment, there's actually a special stream in there that you can go in. You don't have to do the self-assessment, and you can put yourself right in the queue to get tested. Since we launched that earlier today, we're now up to about 4,000 people, and I thank each and every one of them coming forward to get in the line for a test. They're going to have to be a little bit patient. It's going to take us a bit of time to get through that, but NSHA is rapidly standing up capacity to do this. This asymptomatic testing in the next week to 2 weeks is critically important. We believe that there is a large pool of people out there that are infected that they may not even know it themselves. And along with all the restrictions, what we do to start to get back to a more manageable place with COVID is getting all those folk tested. If they're positive, they become cases, and then we do our investigation. So this investment in asymptomatic testing is extremely important. Along with that, you may have seen that Dr. Barrett and Dr. Hatchett and some colleagues on Saturday night were downtown. We were doing a pilot of kind of storefront testing, if you will. And they're going to continue to do this. They're recruiting volunteers to continue to do this. Today, they're on the Dalhousie Sexton campus on Morris Street. And they're going to be doing this in the coming week in various different locations, inviting people, especially this same group. If you work in the bars or restaurants, or if you've been in one in the last 2 weeks, come in and they're using the rapid test at those locations. The rapid test will tell them immediately what their current status is, whether they're positive or negative. It's not good enough to predict whether they're going to stay negative, but it's part of our approach to continue to use testing as an important tool here in Halifax. So we are along with all the restrictions, we are making substantive investments to urgently ramp up testing for this population, an important part of our response. As I said, this is for 2 weeks, and we'll be assessing it. If we need to, we will extend this. I recognize that these are very tight restrictions, but we have to understand that we've been in a very good place for a number of months. We've had very few restrictions. Unfortunately, now I think that's gotten into some problems because we've become too lax around all of us maintaining COVID safety when COVID really hasn't been here. However, I fully believe that if we look around other jurisdictions, both in the country and other parts of the world, as I said earlier, we're doing this much sooner than other provinces. If we understand how the epidemiology of the virus and look at what works to control it, tightening the earliest, as we're now seeing this rapid shift, we're putting tight restrictions on now. Doing it now gives us the best opportunity to be able to lift the restrictions as early as possible. It also puts us into a better place to have earlier community and economic recovery. The longer we let things go on, the harder and longer it will be to recover from it. So that is why we're acting now. I recognize how challenging it is for everybody, but it's important that we do this now. I know the situation is causing a lot of fear and anxiety for people, and I understand that. But we all have tools at our hand that can actually, by all doing it together, we have the ability to control this. So turn your fear and anxiety around and say, what am I going to do to actually bring myself a sense of control for myself and a sense of control for my community around me? For everybody in HRM, now is the time to go to work, go to school, do your essential shopping, and go home. Stay close to home. But that applies around the rest of the province. Now is the time that we really need people to be staying closer to home, watching your social environment. We're working very hard to keep it from spreading to your community. But if you're following strict COVID precautions, even if it does get to a community outside of Halifax, it has the least possible chance to turn into this rapid spread like we're seeing in Halifax. And if we do see it start to appear in another community, we will act even faster based on our understanding of what we're experiencing in Halifax. We will act very quickly to apply the appropriate level of restrictions to tighten down as well. I get that this is an especially challenging time of the year to have to think about this and to do this. Moving into our holiday season with all different faith celebrations, with all the things that bring family and friends together, all the things people like to do to buy each other gifts. But Christmas and our seasonal and other holiday events, this holiday season, other religious events around this time of year, has to be different. We are in a pandemic. Life has to be different. Our first priority needs to be keeping each other safe. When I was thinking about this last night and I reflect around, I'm a person of Christian faith. And other faiths have the same thing, that this holiday season, whether you have a person of faith or not, the holiday season ultimately comes down to a time when we celebrate each other, when we show each other that we care each other and love each other. This year, the way we care for each other, the way we show that we love each other, is by keeping each other COVID safe. Everything else, gifts, faith celebrations, they are secondary to what we're doing primarily, which is about showing that we care for each other. If we come together for the next at least 2 weeks, maybe a couple more, and then we start to slowly ease up, we will get out of this. But we'll only do it if we all do it together. And I want to come back to around the season of giving. There's lots of opportunity online, local businesses. We have lots of needs in our communities and lots of local charities that are struggling. So a great idea of a way that you can show your caring and be giving and contributing to the increased demands in our communities for supports is giving to a local charity. This isn't easy. It's not easy for me. I have a very hard last few days. This weighs on me heavily. We're back to where we were in March and April. It's hard for everybody, and we're feeling that. But just because it's hard doesn't make it impossible. We are where we are. How we get out of this is what I've just talked about. This is our moment. As we did in Wave 1, it's our moment to come together and deal with Wave 2. By acting quickly and aggressively, it's the best way to keep all of us safe, and it puts us on the fastest road to economic recovery. It is now in all of our hands. So let's do what we've been talking about, the Premier and I, for months and months now, Premier, since the spring. Let's support each other. Let's protect and create positive neighboring communities. Let's care for the people around us. I don't know how to say it anymore, but that is what we need to do. That is what we're called to do right now, and I do believe that Nova Scotians will respond. Thank you, Premier.
Thank you, Dr. Strang. Chrissy, over to you.
Thank you, Premier. Again, just a reminder, we'll take one question and one follow-up from reporters in the room in the time that we have allotted, and then we'll go to the phone lines. For those members on the phone, please keep yourselves on mute when I go to the phone lines. I understand from Scotians that some of you are not on mute. We'll start with Jesse Thomas from Global. Go ahead, Jesse.
Thank you. With the 87, I guess, active cases now, it feels like this virus is almost hiding behind the corner, waiting for us to make a mistake and jump on it. So I understand these restrictions. But what do these numbers tell you? Is it going to get worse? Are we going to see where we're seeing in other provinces where we're setting new records of cases? What do you expect over the next 2 weeks?
We certainly see in the next week to 10 days, while we're waiting for the effect of these restrictions to come into play. And we've already put in some restrictions, and even before that, I think people were starting to wake up. So I think it's not that nothing's been happening for the last couple of weeks, but certainly as we continue to tighten down, it'll take at least a week, 10 days to really start to see that impact. That's what I said at the beginning. So we will see, in all likelihood, increasing number of cases. As I said, 40, there were 38 officially announced, but throughout the day, some will be announced tomorrow. Late last night, I was talking to my medical officer of health team, and they were dealing with 44 cases, active cases, in about a 12 to 14-hour period. We're going to have more days like that. We need to make sure that people understand that just because we have more cases in the next few days doesn't mean what we're doing has failed. It'll take a time for it to kick in. What we're doing is everything we can do now we're in a position now in Halifax where there's a substantively increased risk of somebody taking a worker or a patient having to go in and COVID coming with them into a hospital. A worker going into a long-term care facility. Yes, we have lots of protocols in place, screening, et cetera, that provides a very strong level of safety, but we need to understand that we are now in a position that a more vulnerable populations start to become at increased risk. That is why we're acting now. And what I fully expect to see, we'll start to see significantly declining case numbers in about a week to 10 days time.
Go ahead, Jesse, with your follow-up.
With 72% of the cases, I guess, affecting that 18 to 35 age range, just your thoughts on that concern. You mentioned that it's likely there's more cases out there in the public. What's our strategy with identifying some of those cases? You talked about a rapid testing plan. What's that look like?
Well, that's exactly what I described. So we know in this population that there's a lot of social activity. And if we say anybody who's been at a restaurant or bar in the last 2 weeks, that's probably the vast majority of the 18 to 35-year-olds. So that's why we're saying that those folks that we've got it set up, they can do it online to come in, get in the queue, and get tested. We're also then using the Dr. Barrett's and Dr. Hatchett's model of the pop-up testing, which really gives them immediate information, short term, but immediate information around their COVID status, which helps them make important decisions about their behavior at that point in time. That's along with what we've invested in with people who have symptoms and doing the online screening. But what you've identified is critical, the need for testing, and we have substantively, very quickly, increased our capacity in those areas.
Next, we'll go to Mike Gorman from CBC. Go ahead, Mike.
Dr. Strang, we're seeing changes within the health authority when it comes to the delivery of certain services, particularly here in the Halifax area. I'm wondering what conversations, if any, you've had with health authority folks to inform that, and what you know, if at all, about what effect that might have on overall service delivery.
So we are certainly, in my role, we certainly share what we're seeing in the epidemiology with the health authority and the potential impact on them. My medical officer of health team, we have lots of discussions with the infectious disease, the occupational health and safety folks, and senior management with the health authorities. They then take that information and they make their judgments on what they need to do, whether it's occupational health and safety for staff, infection control, enhancing measures around patients, anybody coming into the hospital as a patient. They are right now looking at what they need to do to deal with a potential surge of hospitalizations due to COVID-19, and then working through what that means in terms of how other services need to be shifted. And so that, I don't have the details on that. We've asked the health authority to do that work. And they're in clear understanding and fully we're working completely collaboratively on how they anticipate what may come their way related to COVID. But I have to emphasize that if we can keep this to the 18 to 35-year-old population, it's not that there's zero risk, but there's a low risk of having severe disease from that. So that is one of our objectives. By keeping it, acting now, keeping it to this population, it's one of the critical things we're hoping to achieve is protecting our healthcare system as best as possible.
Go ahead, Mike, with your follow-up.
Premier, in the last couple of months, we've seen the universities in Antigonish and Wolfville and Clare very quickly and publicly deal with issues when they arose in their community as it related to their students. And some folks have pointed to a pretty stark contrast with the way Dal either has or has not publicly addressed the party that happened a block away from campus on Friday. Are you satisfied with Dal's response to that situation, particularly in light of the very close partnership they have with the province when it comes to administering COVID aid?
Listen, our post-secondary institutions have been great partners for us pre-COVID, but certainly during this period of time. All of them worked with us early on with our testing model, ensuring that any students coming in from outside of the Atlantic bubble were isolating. We did that testing model that was in cooperation with them. I don't know where all of those young people that were at that party actually went to. I do know that there are two cases that were announced from Dow. We have, as Dr. Strang just announced now, we have a pop-up testing model in that facility now, working in conjunction with Dalhousie and our partners. We also know, you mentioned a number of other cases outside of HRM where there were activity. Law enforcement laid fines individually in that particular case. So that was the model we'll be using in here. That we'll be forcing those fines will be laid on anyone who crosses that threshold. But all of the universities have been supportive, and we'll continue to work with them. It's as Dr. Strang just talked about, it's a critical demographic that we will need to be vigilant on, keep on top of, and we'll do that.
Next, we'll go to Andrew Rankin from the Chronicle Herald. Go ahead, Andrew.
Premier, now there's 87 cases, and you're announcing pretty serious restrictions today. So I'm just wondering, can you commit to making some more data on these cases? Can you make them public? So I'm talking about cases. I'm talking about where these transmissions occur, whether it be at retail, whether it be at gyms, whether it be at wherever. Can this information be shared with the public and can be updated? Can it online?
I think Dr. Strang spoke to that last week. He has a legal obligation to protect the health information of individuals. We're providing when we do contact tracing where people have been. Sometimes it's hard to identify which actually spot where they might have picked up COVID. I believe the announcements that have come out through public health have indicated every place people have been, and they've been working through the individual contact tracing to identify that, and as much information that public health feels comfortable giving has been given out.
So I'm going to add to that answer too, if you don't mind, Premier. No. So Andrew, I think you're focused on the wrong thing. It's not about individual cases. We know how this virus is transmitted. It's in when you bring people together, especially in indoor environments when they're not respecting physical distancing. If they're not masked, it makes it even worse. That can happen, as you've seen our public notifications. It happens in bars, in restaurants, in private parties. It can happen in gyms. So we shouldn't worry so much about more detail on individual cases, but we need to worry about what we know about the virus and what are we doing to create safe spaces. And that's why we're shutting things down with a focus on those environments that actually facilitate crowds of people coming together in close contact. And then when we get things under control, we will open those areas up again. So people need to focus on what are the general community settings that are at higher risk, and not trying to worry about getting every detail on any individual case.
Go ahead, Andrew, with your follow-up.
I'm just gonna, I have another question. Can I follow up with this, with Dr. Strang's response?
Quickly.
Okay. For people, if you're going to impose restrictions on certain businesses, then I think it's fair that you provide the information, provide the data that justifies these restrictions. I think that's important.
Andrew, look at the long list of public notifications that have happened in the last week. How much more information do you need, along with the explosion of cases, to tell us that we have a problem and we know where people are being exposed?
Andrew, move along to your follow-up.
Just with contract tracing, I'm wondering if you can provide some information on the contract tracing program to the public. And I think last month, other Atlantic provinces signed contracts with Statistics Canada to provide more contact tracers to each respective province. But I don't think Nova Scotia at that time hadn't signed on to the program. Have you signed on to that program since then?
We were in the process of finalizing the agreement on that. I haven't got an update today, but I said to my team that working with me yesterday that it's a priority to get that in place because we have federal StatsCan employees that can be brought to bear to help us with some of our work in public health.
Next, we'll go to Lindsay Armstrong from All Nova Scotia. Go ahead, Lindsay.
For the Premier, recognizing the need for these restrictions on dine-in and retail, the Canadian Federation of Independent Businesses reported in October that majority of small businesses have said they would not survive another year under COVID restrictions. Understanding the explosion of new cases, what is the province prepared to do to protect small businesses and those they employ as we face a second wave?
That's a great question. As you know, the federal government just announced a new rent program yesterday, I believe it was, that'll go directly to the company. That's a positive thing. We focused unlike in March where we really shut down a certain part of our economy all across Nova Scotia, we're now working with the associations that have been impacted here in HRM to identify if and what we can do to help them.
Go ahead, Lindsay, with your follow-up.
I'd like to move towards testing. I understand we test 1,561 people yesterday. We're in the last week of November now. Dr. Strang, why is it that we haven't reached that 2,500 testing goal that we had set out for mid-October, understanding now that we are seeing such a significant increase in daily cases?
So that 2,500 was something that was our capacity. I fully expect that in the next, we got 4,000 people on a list, and we got to get them through to get tested. So I fully believe that we're going to stretch that capacity, and we're actively working to how we go beyond that 2,500 capacity in the days ahead.
And I think it's important, we identified last week, we're looking at a strategy to test long-term care employees across the province, so we're looking to ensure that we have the capacity to be able to do that. And as you're noticing in some of our sister provinces with rotational workers, a testing program. So the 2,500 number, which we worked to, I think we got there by mid-November, that capacity will begin to be used up pretty quickly.
Next, we'll go to Tim Bousquet from the Halifax Examiner.
You took my first question, but I'll follow up on that. There seems to have been a change in strategy from the potential exposure advisories that have gone now to pretty much, well, every bar that's listed, every restaurant is changed from check for symptoms to go get tested. And I'm wondering if you could speak to that. Should that be retroactive to places that were named before? If not, why not? And why aren't the same sort of get tested requests given for other establishments?
So every time we do a notification, so we follow up a case, what public health does is say, where was that person when they were infectious and who could have been exposed? So as much as possible, we follow up directly with individuals. If we can't, that's then when we use a public notification. And part of what goes into the work around the notification is how much risk was there? What's the likelihood that somebody was actually exposed? And so when we and there's a set criteria, the MOHs look at that. This is part of their expertise. When they make a judgment that when it's low risk, that's when we use the notification as just, you may have been exposed, but it's low risk that you were, so just watch your symptoms. We're actually going to stop doing those because they're no longer effective. The message for everybody in Halifax, as I said earlier, we are all now at increased risk of being exposed. We all should be actually paying more attention to, am I feeling unwell today? If I'm not feeling unwell, then I stay home or go home and do the online assessment. As we do, if it's judged to be a higher risk of actually somebody being exposed, and the reason, and often it is the bars, because first of all, people are in there for a substantive period of time. They're not wearing masks while they're eating or drinking. Often when we have those cases where we know that there's been at least one additional case, somebody was in there and we trace it back that their only point of contact would have been in that bar. That's when we then go out and say there's a higher likelihood that anybody who was there at a given time of date may actually have been exposed, and there we give them direction to go get tested right away. So that's always been in place. It's the reason you're seeing more of it is simply the evolution over the last couple of weeks of how this virus and its activity is rapidly taken off, and it's taking off, coming back to Andrew's question, in these environments where there's groups of people in close contact without masks, etc.
Go ahead, Tim, with your follow-up.
Related, I think it was a week or 10 days ago, you had given some figures about some expectations about hiring more contact tracing. They're obviously working hard. Do you have enough? Are there gaps in that coverage, or are you still bringing more people on, or what's the situation there?
So we're now has made it a priority to get the help for the federal help around kind of rapid response. We're continue to work. I know public health continues to work. Our target was to hire 100 people. Some of the challenges are who's out there that has the skills to come in. Not everybody can come off the street and be a contact tracer. So there's a basic experience and then training people up. But that continues to be a priority for public health to build that capacity, while at the same time everybody in public health is flat out in the last few days dealing with what we have in front of us today. So there's no doubt that public health is very stretched right now, but they are working creatively. Have a call coming up tomorrow with the Senior Director of Public Health. What do we need to do? What supports they need to do to be able to continue to do their very important work of case and contact follow-up.
We'll now move to the phone lines. Again, a reminder, you have one question and one follow-up. We'll start with Keith Doucette from the Canadian Press. Go ahead, Keith.
Hi, Dr. Strang. I want to revisit the sports travel that you discussed. Conspicuous by its absence was mention of junior hockey teams, the various tiers, and the Halifax Mooseheads and the Q League. They have to travel even when they're within the region long distances. Are you thinking about that? And if not, why not?
So this applies to them as well. Maritime Junior Hockey League, Quebec Hockey League. If they're a Halifax-based team, they're not to travel for the next 2 weeks. If they're a Maritime Hockey League along the South Shore or wherever, they are not to come into Halifax to play.
Go ahead, Keith, if you have a follow-up.
Yeah, thanks for that clarification. It just didn't seem clear at the outset. The other thing is schools. We're getting close to the Christmas break in any event in Halifax and elsewhere. Why not just close schools down as an extra precaution? And might that be something you consider as the epidemiology evolves and we get closer actually to that Christmas break?
So I'll always watch the epidemiology, and if I feel it's appropriate to move beyond closing individual classrooms or individual schools in response to a case, and we have to have a broader approach, I will not hesitate to bring that recommendation forward. We have worked really hard to create safe environments in schools. It's important that children and youth are in there for their learning environment. I don't in our epidemiology at this point in time could not justify why we would broadly close down schools or even shift to the blended learning model.
I would also say to that, Keith, when we looked at the schools that we closed for 2 weeks, there was a fair bit of activity in the communities there. Dr. Strang and his team will continue to work in communities where we have a school outbreak or a case in a particular school to look at what is happening in the community. And we will, as a group, the Department of Education, will monitor, obviously, working with our partners at the Teachers Union, teachers and parents, about their anxiety level and what is the right recommendation from the other aspects of delivery of education. The number of parents who just choose to keep their kids home, how does that impact our ability to actually deliver a course without leaving a certain percentage of the students behind? So all of that will be managed by the Department of Education and the minister, who have been on top of this from the get-go. Been on the phone with them regularly. Obviously, we follow the lead of Dr. Strang, and he's absolutely right. The epidemiology and the science supports the decision to keep these schools functioning as best we can. But the department has to look at the other side of this as well, and that's the challenge of trying to make sure that we respond to all of the fears and anxiety that students and parents have. And we don't want to, by rushing to close schools, we don't want to add undue fear to them, but we will certainly be working with communities, and that's why this school will be closed until next Monday at the minimum.
Next, we'll go to Natasha Pace from CTV. Go ahead, Natasha.
Thank you. Dr. Strang, in the news release today about testing for bar staff and patrons, it says that walk-in testing is not available. People must book in advance, and there are limited spaces available. Can you explain to us why there would be limited spaces available for testing?
So that's only on a daily basis. You got to understand that there's only so many people that we can, everybody takes a certain amount of time to get a test. We don't want people lining up and have big lineups. That's not COVID safe. So we're asking people to go online, make an appointment, like any appointment booking. There's only a limited number of cars that your car dealership can service every day, right? There's a limited number. That limit doesn't mean we're restricting numbers. We want to test as many people as need testing. It's just we can only do so many people in a given day.
Go ahead, Natasha, with your follow-up.
Thank you. I know obviously we're seeing community spread and the spike of cases in HRM, but what would your message be to folks in other parts of the province who, by and large, haven't been as concerned about COVID in their community? But now, of course, we're seeing a case in the northern zone and in the western zone. So what's the message for folks in rural Nova Scotia?
How quickly it has happened in our capital city. Last week we tried to articulate to Nova Scotians, so we have examples within inside of our own country, and how quickly this virus has spread. Dr. Strang talked about the stealth nature of it, where people are carrying this virus not knowing it. If there is anyone living outside of HRM who believes this will not come out into their community, they're being naive at best. And I can't say this strongly enough. It is absolutely critical that people do only essential travel. Non-essential travel at this point, whether you're in rural Nova Scotia or in HRM, should be prohibited. We do not want you going shopping out into rural communities if you're from Halifax, and we don't want you, if you're living in rural communities, to come in here. We're attempting in many ways to try to protect the livelihoods as best we can of Nova Scotians, at the same time protecting their health. The very first time we made major impacts on Nova Scotia families from one end of this province to the other when we closed down entire sections of our economy. We're trying now to follow the epidemiology and the advice of public health to be able to do that in a particular zone in the province. And the only way this will work is if every Nova Scotian believes this virus is outside their door, whether you live in Upper Granville or whether you live down in the south end of Halifax. This virus is one trip away from landing on your doorstep. And I don't know how much more I can say to have people take this. And I want to thank many, many, many Nova Scotians who have been following the public health protocols. But if you're coming in here to go shopping, stay home. You have lots of places to shop where you live. If you have to come in here for a medical appointment, of course do it. But then go home. I can't say that enough. Otherwise, Dr. Strang and I are going to be forced to make more difficult decisions that impact the livelihoods of many Nova Scotians.
Next, we'll go to Paul Leger from Radio-Canada. Go ahead, Paul.
Yes, I'd like to know, Premier, more difficult decisions. What exactly would these decisions be in the future should the present restrictions not be enough?
Well, I mean, go back to March. We locked down a much larger part of our economy. We laid out the reason we moved into this working with the zone areas that we could, as we're trying to do now, is to capsulate this virus here in HRM to be able to deal with it and eradicate it. But we can. The restrictions will only work if all Nova Scotians participate and practice the public health protocols and follow the rules. This is a couple of weeks. I know this has been ongoing. Dr. Strang's talked about the stress and pressure that he's been feeling for the last number of days. That's being felt by many people who lay awake at night with the responsibility to protect the health of Nova Scotians, at the same time making decisions that will impact their economic health. One of your colleagues mentioned about businesses that have talked about they could not survive another shutdown. Well, the reality is public health and health protocols will take priority, and the health of Nova Scotians will take priority. But the weight of knowing that you are going to actually potentially close somebody's businesses for good is not a thing you take lightly, and we can prevent it. That's one of the frustrations for me, and I think I don't want to speak for Dr. Strang, but one of my frustrations here is we all can prevent this. We put masks on earlier. I think that is helping us keep the spread down right now, following the public health protocols, washing our hands, keeping our distances. Do we really need to do the level of shopping that we may think is the right thing that we would normally do? No. We want to prevent having to pull back our healthcare system. In the first wave, we were down. We closed about 30% of it. If you're one of those Nova Scotians whose surgery was canceled in the first wave, we don't want to have to do that to you again in the second wave. That's why it is so important that we just continue to follow the public health protocols, but make no mistake, we will do what we have to get a hold of this virus.
Go ahead, Paul, with your follow-up.
Yeah, now that we're into the second wave, we're hearing that the 811 service is overwhelmed with calls. What's being done to handle this surge in callers?
That's why we moved a lot of the pieces online. So the public notifications are going to change. Up until today, we were telling people that if you were in one of these places that you should get tests, call 811. That is now shifted, and the notification will have the appropriate information. People can now go online and book their own appointment without having to go through 811.
Next, we'll go to Jean Laroche from CBC. Go ahead, Jean.
Good afternoon, sir. Dr. Strang, from what I can understand or what I remember, because I've heard you on these COVID updates now for the better part of 9 months, this is the first time that you've asked people to call police if they see something they think is wrong. I remember very distinctly the tone before now was, let's not rat each other out, let's just be kind to each other. So I wondered about what is prompting this shift.
It's simply, Jean, because we've had not many, I firmly believe the majority of Nova Scotians are doing the right thing. But all it takes is one uncontrolled, large private party to spark dozens and dozens of cases and then going back out into community. So we have to be very strong on those. And as I said, we're working with our from an enforcement perspective, but often those are happening, police can't be everywhere. So we absolutely need, one of the ways we can look after each other is to actually say, hey, hang on a second. What's happening over there is putting me and the rest of my community at risk, and I'm going to ask for help from the appropriate enforcement officers.
Go ahead, John, with your follow-up.
And it was fortuitous that you changed the rules on masking in apartment buildings, because I heard from somebody who lives in an apartment building today who said that one of the problems in their building was that because it's partially completed, a lot of workmen coming in and out, no one's wearing masks. And when they phoned public health in Dartmouth, the response they got back was, well, the problem with apartment buildings is that they create a gray area in the law. And I just wondered if you could speak to that and what other measures might be you might be contemplating to try to make sure that people in their own homes, be they apartment buildings or multi-unit buildings, are safe.
So when we first brought out masking, there was a lot of discussion with, how far do you go with what do you define a public space? And that is the challenge around the common areas in a multi-unit dwelling are actually not a public space, and so we drew a line which was an appropriate line given where we're at with COVID. Now, because in HRM we have far more COVID activity, we have to expand that line and increase the number of places, even if they're technically not a public space, that there's enough people moving in and through them that they're putting each other at, there's enough risk in there that we have to add on masking as a substantive protective measure in those common spaces.
So I just want to add, the building that I stay in when I'm in the city, I want to just commend the small business owners across this region, service people coming in to do work. All have been wearing masks. I've seen people drop off parcels wearing masks. Some of the construction crews that have been there remodeling some of the units have been wearing masks. Those of us who stay in that apartment as the early part of the protocol that was where we lived, so it was part of the exemption. I see many of them wearing them now. We'll see all of us wearing them now. But I just want to give a shout out to the business community, whether it's not people coming in doing work in many of the buildings that I walk by to come to work. I see them all wearing masks. So thank you for following public health and providing support and, quite frankly, safety for the people you're going to visit.
Next, we'll go to Nabal Snand from the Chronicle Herald. Go ahead.
Good afternoon. So from my understanding, backward tracing to find the original source of infection can be difficult. So how long after starting an investigation into a case does public health determine they won't be able to find the source of infection?
So when we have a case, we work in two directions, the forward and the backward, as you said. Our first priority is to say to the case, make sure they are isolated, and then we start to work who may they have been exposed to that case, because those are the most urgent ones to actually get them and test them and get them isolated, because they may not yet be. We need to get them isolated as quickly as possible to prevent any of them becoming infectious and spreading. But we also try to do work to say, well, where does the case that's in front of us, where might they have been infected themselves? And to do that, we need to go back and look at all their activities for the prior 2 weeks. Now that we're in the midst of this significant outbreak in the Halifax area, that backwards tracing frankly becomes less important, because we know the virus is in many different places. And so our immediate focus with public health is going to be on making sure cases are isolated and their forward-looking contacts, that we get a hold of them as quickly as possible, test them and isolate them as well. That's all to do with minimizing any further spread around the cases. And all the restrictions we're putting in, all the asymptomatic testing, in many ways, that takes care of the backwards contact tracing. It takes care of where people may have been exposed, because we're working rapidly to test other people, and when we've tightened down substantively restrictions on the areas and on the facilities and locations where we know that concentrated social activity has been causing transmission.
Go ahead with your follow-up.
Thank you, Dr. Strang. So I just wanted to clarify something. Is pop-up testing only for bar and restaurant patrons and workers, or is it for anyone in the area where the testing site is?
We're focusing on people who work in bars or have been in bars or restaurants in the Halifax area for the last 2 weeks. because that's the epidemiology. That is the group that we're saying is an increased risk. We need to focus. While we're rapidly building capacity, we do have limits to our lab and our testing capacity. And so the priority for testing, along with people who have symptoms, is people who are at a highest risk of actually being exposed, which is those who work in or have recently been in those the restaurants and licensed establishments.
And that's all the time we have for questions today. Go ahead, Premier.
Thank you, Tina. Today we've talked an awful lot about what we are doing to stop the spread of COVID. The question now is, what can you do? You've done so much already. We've asked you to limit your visits. You did. We asked you to wear a mask, and you did. We asked you to follow all the protocols, and for the most part, you did. But now we're asking everybody to dig a little deeper. This is serious, 37 cases in one day. If we don't get a handle on this now, it has the potential of the second wave washing over us. We can contain this spread of the virus in the greater Halifax area, though, if we follow the measures put in place for the next 2 weeks. We cannot flatten the curve or stop the spread without you continuing to work hard. I want to thank Nova Scotians for all that you've done to this point. It's been amazing. You've really worked hard to protect each other. But now we need to do more. We need to tighten up. That means limiting your movement. Go to work, go to school, get your necessities, go home. And once you're home, stay the blazes home.